Hi, everyone. It is Dr. J here. We have another episode today. This is the 411 on diabetes and exercise. So, before I start, I just want to say that this information is for educational purposes only. So, if you have any questions about your health, please refer to your primary care physician. All right. So, let's talk about diabetes. First of all, how is it diagnosed? So diabetes can be diagnosed multiple ways. First, on a blood sample with a test called an A1C. And your A1C has to be 6.5% or more for you to be considered diabetic. Next, it can be diagnosed on a fasting blood sample of over 126 or higher. It can also be diagnosed on an oral glucose tolerance test. And these tests will typically be tested in pregnant patients so they can be evaluated for gestational diabetes. And the oral glucose tolerance test has to be has to be 200 or more to be considered diabetic. Next, it can also be diagnosed on a random blood sugar sample of over 200 with symptoms of high blood sugar, such as nausea, vomiting, or frequent urination. All right. So the next point that I want to highlight is that your cardiorespiratory fitness is a strong independent predictor of death. So that means that the fitness of your heart and lungs can strongly predict death. So that also means that you want to be working your heart. You want to be using those lungs to breathe in and out during your workout so you can have those aspects of your body fit, all right? And you can improve your cardiorespiratory, that means your heart and your lungs. You can improve that fitness by doing exercises that increases your heart rate and creates an effort for you to breathe, okay? So that is called aerobic activity. And you can also do that with muscle strengthening exercise. Now, to get into muscle strengthening, I wanted to say that when you're doing muscle strengthening exercises, you can start at 10 to 15 repetitions and you can do 1 to 3 sets. So that is a good way to start. And if you want to increase your weight, it's better to start at lower repetitions before you progress to more. So for example, let's say you're doing bicep curls, right? And you're able to do 15 bicep curls, right? And you're using 5-pound dumbbells, okay? Now let's say you're like, okay, well, I've done these 5 pounds of dumbbells, 15 reps, 1 to 3 sets. Now it's easy. I want to increase my weight. You want to lower your repetitions first. So you would then increase your weight, let's say to 8 pounds, and you would do 8 to 10 repetitions of 8 pounds, right? Until you can get to, let's say 10 with ease. Then you can go back up to 10 to 15 reps at 8 pounds, okay? So that is a great way to improve your muscle strengthening and also make sure that you are gradually progressing so that we can improve that cardiorespiratory fitness like I discussed earlier, okay? So the next thing that I want to talk about is hypoglycemia or low blood sugar. So it's important, especially if you're diabetic and more especially if you're on insulin, to check your blood sugar before, during, and after your exercise, all right? Because after you exercise, your blood sugar can go down, right? And sometimes it may not immediately happen after the exercise. It could actually go down up to 12 hours after the exercise. So it may not be immediate, but it can still go down up to 12 hours after your exercise. So it's important to check your blood sugar after exercising, and especially important to eat something after you exercise to prevent those symptoms of low blood pressure. And let's say you don't know what those symptoms of low blood pressure are. You may feel clammy, you may feel shaky, you may be sweating, may feel anxious. Those are some symptoms that you're having low blood pressure. This is more common in people who take insulin. So I want people who take insulin to be very cautious of of how they're feeling, especially after they're done exercising, okay? And make sure you're checking your blood sugar often to make sure that your blood sugar is not too low. And it's considered too low if it's less than 70. Okay, and if it is less than 70, you can drink a fruit juice like apple juice or orange juice or sugar tablets. You want to make sure that you have that available just in case that does happen. Okay, all right, well, this concludes diabetes and exercise. I should say the 411 on diabetes and exercise. I hope you find this helpful. Let me know in the comments what you thought. If you have any more content that you'd like me to discuss, let me know. All right, and I'll feature it on the YouTube channel. Well, I hope you all have a great day. Bye.